Hello, and thank you very much for joining us for the latest World Horse Welfare Wednesday webinar, which is all about wounds tonight. And if you've been with us before, you just know we need to mark time whilst we get our friends to join us on Facebook Live. Thank you very much for joining us by Zoom. As before, we have a poll question coming up. You'll be able to get involved in that. So also a very warm welcome to everyone who's just joining us on Facebook Live for the next in our series of World Horse Welfare Wednesday webinars, which tonight in the W fashion is all about wounds. And we're going to learn about wounds, what to do when you spot one, how best to care and manage for them, and importantly, when it's an emergency, when to call a vet, and what can be dealt with at home. And to help us get through all of that, I'm delighted to welcome Chris Tufnell, President of the Royal College of Veterinary Surgeons, runs a very successful equine practice down near Newbury, and Chris is going to be flying solo tonight. So this is a bit of a new venture. We normally have a lead presenter and at least one other supporting act, but not tonight because Chris is flying solo and he'll do a brilliant job. But of course, to help him do a brilliant job, we need very much you to play your part. So as before, this is very much a two-way conversation. Chris is going to speak to us for about half an hour, and then it's straight over to you for Q&A. And we've got a lot of people signed up tonight, so I'm sure you'll give us lots of really good questions. On Zoom, please use the Q&A function, or on Facebook Live, please put them in the comments section. If you're on Zoom, by all means, chat amongst yourselves on the chat function. But if you've got a question, it's really helpful if you can put them on to the Q&A function. And also, if you're on Zoom, if you see a question that you were going to ask that you really like the answer, you would really like the answer to, then please don't write it out again, just upvote that question. And again, that's much easier for me to try and get through as many questions as possible. If you're watching us on Facebook, then please do share the live video. And of course, if you enjoyed tonight's session, it'd be great if you can tell your friends and colleagues. All of our webinars tonight and all the ones since back to June 2020 are available on our YouTube channel. And we will going in a fortnightly rhythm at the moment for our webinars. So if you've got something you would like us to cover in a future webinar, then please do send that in to us at education@worldhorsewelfare.org. And just to give you prior warning, in 2 weeks' time, which is on the 23rd of February, we will be running a webinar on how to manage and care for the older horse. Of course, not very long ago, an older horse used to be viewed as anything over 15 years. Of course, horses live a lot longer than that. And it's great that we've got Professor Pat Harris, international renowned veterinary surgeon, and Nikki Jarvis from Red Wings Horse Sanctuary. So that's going to be a great session in 2 weeks' time. So now, having said all that, I'm going to now share my screen. And before I introduce Chris, I'm going to ask you a poll question. This is the webinar you're at, so hopefully that's what you're expecting. And the question is, do you feel confident you can assess when to determine the severity of a wound on your horse? Now, I'll read all of these out because I know if you're on a Facebook Live, you might not be able to see them. So do you feel confident you can assess and determine the severity of a wound on your horse? We've given you 4 options. No, I call the vet straight away if I see any blood on my horse. Secondly, not really, it can be tricky, but I can probably tell the difference between a superficial wound and something more serious. Or thirdly, probably. Unfortunately, I have had a lot of experience as my horse is very accident prone. And fourthly, yes, I know exactly what is serious and needs immediate veterinary attention and what I can treat myself. So that's over to you to answer that. Either you can answer it directly on Zoom or through the comments function on Facebook Live. And whilst you're answering that, I'm going to introduce you to Chris, who will be very well known to many of you. What we haven't got on the list here, obviously most importantly, is that he is a current trustee of World Horse Welfare, but he is a lifetime of equine veterinary practice, frontline veterinary practice. So in terms of those the topic we've got tonight, there can be no one better. But Chris doesn't just have a UK perspective on these things. He also has an international perspective in having been around the world across Africa and India as well. Now, I don't think I can get back to my screen where I've got it, but Chris was just telling us one of his children has gone off to Mozambique. A few years ago, when he was out in Mozambique, he actually, you hear people doing the London Marathon in a deep sea diving suit or dressed as a lion. What does Chris do? He goes to Mozambique. He castrated, I think it was 24 horses, 2 dogs and 1 cat in 24 hours. I don't know whether that's a Guinness World Record, but I reckon it's pretty close to it. So Chris, as you can see, is very, very practiced and practical indeed, and we'll turn his head to anything. So Chris, it's brilliant to have you on the webinar this evening. Before I hand over to you, of course, I'm going to ask Basil to give us the answer to the poll question, where there was those 4 options to see what kind of a response we get. So look at that. Very few have said, no, I call the vet straight away. Only 2% of you. By far the most of you have said, you're not that confident. It can be tricky, but I can probably tell the difference between something minor and significant. And then about a quarter of you have said, unfortunately, I've had lots of experience as my horse is very accident prone. And then a few have said, yes, I know exactly. So a good spread, but the majority at that not really level, or that's where you feel you are. So you're very much in the right place this evening or today. So Chris, I'm going to stop sharing my screen and hand over to you.
Great. Well, thank you very much indeed, Roly. That's hopefully everybody can see my presentation, and hopefully it'll scroll as I expect. I did, some of you that have been lucky enough to be on safari will be familiar with the concept of the Big Five. I was visiting these lovely people in Mozambique, and I did warn them, having castrated 3 species in 24 hours, that I might be going for a Mozambican Big Five, and they ought to watch themselves. But it was an amazing experience out there, and I can recommend it really highly. Now, I have one person to thank above all for tonight's presentation in terms of supplying a lot of photographs for me, and that's Professor Derek Knoppenbelt, who was at Liverpool University's Equine Hospital for a very long time. A lot of you may have been exposed to Derek because of his expertise in sarcoids, which he carries on working on. But Derek was kind enough to supply some cracking photos for this presentation. And so
Chris, you seem to have gone on to mute. Not sure what, if you just accidentally.
There we go. Yeah, I did accidentally when I was trying to move on. Sorry, apologies. This is not a webinar for those of you that are squeamish and are likely to feel ill. If you are of that persuasion, please do sit down. There are a lot of people who feel a bit odd when they see a bleeding wound, either live or on a picture. And sometimes you can get over this. And all of us, I can promise you that familiar with them, had that feeling when we first started, but sometimes you can't get over it. And if you're one of the people who can't get over it, that's fine. Just make sure that somebody else is going to be dealing with the wound, because there's nothing worse than trying to deal with an equine casualty when you've got a human one sprawled on the floor that needs looking after too. So if you know you're one of those people, please probably sign out of this webinar and find another one for this evening. And certainly know that you need somebody around to help you when there's a wound on your horse. So to get cracking on that front, here's the red stuff straight away. We're obviously going to be talking about wounds. What I want you to take home from this, and we'll try and summarize them at the end, is a few principles, because there's a huge amount of detail. There are so many wonderful ways that horses find of injuring themselves, and in no way would we ever design the wounds in the way that the horses manage to design them in the field or when competing. And so there's almost every one is unique. So you can't have a list of descriptors for various wounds and what you do with each one, but you can learn some very key principles. And I'm hoping that over the course of the next half hour, we will get onto those. There are a few slides which are fairly heavy on text. I'm not going to read all the text to you. If you are struggling to keep up with the text, you can watch this webinar again, so you could come back to that later. And I make no apologies for repetition in this webinar. The principles deserve repeating because they are just so critical when it comes to looking after wounds. So these are some of the things that we want to know when we're dealing with an accidental wound. And probably one of the things to remember above all else is to keep yourself safe. This applies to all first aid, but when you look at situations like in these, there are in these bottom two pictures, it would be very easy to end up with a hospitalized person trying to deal with these horses. And whilst we all care deeply for the horses and we don't want them to come to any harm, when they're in a concern, sadly, unlike cows who would just lie there and wait for you to slowly cut them out, they tend to panic a little bit more and their legs go all over the place. Particularly their head is another thing to worry about. The head will be flying around all over the place and it's so easy to get injured. So please, please stay safe. And if the horse is lying there quietly, you've got time to go and put on a helmet and a stout pair of boots and make sure that you're in a safe area. We're then going to think about where the wound is on the body, because actually its size is not the critical factor here in terms of how dangerous it is for the horse ongoing, because what does it involve is critical to us, and for you it's what it potentially involves which is important. We're going to try and work out when we turn up as vets what it involves, but it's knowing that the potential things it could involve. How it was caused is really critical. Horses hitting an object, a blunt object at speed, may do significant damage that they wouldn't do if they just grazed it on the fence as they were walking in from the field. So you being able to tell us how it was done was really, really critical. We're going to talk about bleeding and what you do about that, and we're going to talk about what happens when the horse can or can't move. What we're really trying to get is we're trying to get to a point where the way the wound is treated after the horse has finished creating it and contaminating it and filling it full of mud and whatever is only beneficial and leads to the clinical process of healing. And as you can see here, these wounds can look really dramatic to start with, and we're always delighted when we see a wound on the trunk of the horse, so that either the neck or the main part of the horse and not the legs or extremities, because generally they heal really, really well. And the one thing that most people don't understand or haven't heard of before is that an awful lot of wounds heal by contraction, and this is a really good demonstration of that. And what I mean by contraction is that the cells, some of the fibroblasts within the skin, are just pulling themselves together. So the wound will stay the same shape and it will just get smaller because it's being pulled together. And so if you're the person who's looking at it every day, maybe once or twice a day, it's tempting to think you're not getting the wound to heal because it isn't filling in at all. But actually, if you got your ruler out and measured, you'd find that the edges of it are getting closer together. So there's a process here to go through, and the first part of the process is, I'm going to use an analogy here. It's a bit like a building falling down. Essentially, when you first have that building fall down, you've got bits of damaged building that are in the way, you've got rubble in the way, you've got a whole load of dirt and dust and rubbish. And the first part of the process, and this is what the body is doing, is to get rid of the dirt and rubbish and useless cells, damaged tissue. And pus is something that most people instantly see and assume that it's caused by infection. And yes, indeed, infection will cause pus, but in some cases, the pus is actually just accumulations of white blood cells as they're shedding damaged tissue, dirt from the wound. So the wound will go through a period where it's chucking out material that it needs to get rid of. And we can help that process right at the very start by trying to reduce the amount of material in the wound and reduce the number of bacteria, and we'll come to that. Once it's done that, then you're going to get the brickie to come in and bring some of the materials needed to rebuild the building, if you like. And so that's when we go through a period of what we call granulation. Now, it's not terribly helpful when most people have only heard of granulated sugar to think of granulation tissue. It's actually what it looks like down the microscope. And granulation tissue is a very basic building block, if you like. It's the basic tissue that fills in the wound the first time. And you'll hear us talking about a lovely granulation bed, and that's what we're trying to get towards. And the top right picture here is starting to granulate, but you can see there's yellowy material coming away. It's still discharging material. But the bottom left, you can see it's starting to get much healthier looking. There's still a bit in the middle, which is very dark red and probably needs to improve, but the outside bit's that lovely salmon pink color. So, and then things starting to improve along the bottom there. So the healing will happen by contraction as the wound gets smaller and smaller, and infill from granulation tissue. Now that's about all I'm going to talk about in healing, but one of the most important things to remember is that we can do so much harm if we're not careful in these early stages and over the following days to this process. Cells, skin cells are very delicate things, and they need looking after very carefully. So we need to keep that in mind right from the very start. Where the wound is critical for all of us. You look at these wounds here on these horses. There are two things to remember. Firstly, on the left-hand side, we've got what looks like a fairly innocuous, tiny wound potentially, but that wound could easily involve an underlying joint. And that's one of the things in horses that is most critical to us, is the skin over the bones of the limbs that is very thin, and it overlies some pretty serious synovial structures. So a synovial structure is the inside of a joint, or a thing called a bursa, which is a bag of fluid that allows tendons and ligaments to run smoothly over joints. And if they get infection in synovial structures, you really have got about 24 hours to try and flush that out and get it really clean before you'll get a point where they'll start to scar up. And all our horses are really intended to be athletes. So we want their wounds, we want their joints and their bursas to heal optimally. We want them to heal where they're not scarred up, not glued together, and the joints are able to move freely. So that wound at the top left there looks really insignificant, may well be insignificant, but until we know that it isn't involving an underlying joint, in this case the pastern joint almost certainly, then we won't be really confident about it. The other thing to remember looking at the next wound along, which is probably a staking injury, so in other words the horse has run along and a bit of fence has gone up, is that wound's way up inside the back leg. And there's at this picture, there's a bit of bruising there, but there's not an awful lot of bleeding. And so there are wounds that are hidden away from us, and it's quite easy to miss them if you're not careful. And whilst this horse on the right-hand side may well be, who knows, a neglect case, God knows, I don't know the origin of that picture, and some of those wounds may well be pressure sores actually from the horse lying on the skin, which is over thin bone. But the important thing to remember is just because you found one wound, that may not be the only wound. So it's really critical to have a look really carefully on the horse, because I've seen plenty of horses with really big, impressive wounds that everybody's really worried about, and they ring you and tell you where the wound is, and they expect you to concentrate on that, and they then wonder why you're furtively going around all the legs. And what I'm looking for very often is that wound on the top left-hand corner there that may well be significantly more important for the horse's future than the bigger, slightly more impressive wound. We get wounds in special places. Wounds in eyes are particularly critical. Now, this is definitely a moment to look away, particularly if you had an early supper, because I can tell you as the pictures arrive, they get a little bit more gruesome. But please don't see a horse's eye like this and think, well, a bathe with cold tea is going to sort it out. This is what is under that eyelid. Obviously that really nasty blackthorn, and you can see the effect it's had on the eye, and yeah, a nasty bit of material, and once it's come out, the eye can clear itself quite satisfactorily. We will end up with some scarring. The foreign bodies and eyes are really nasty. You're going to blame Derek Nottenbelt for this final picture because this really is a stomach turner, I'm afraid. But it obviously can happen to people as well. And very significant tiny wounds in eyes can be really, really significant. So take eyes very seriously. This is just a series of pictures to show another blackthorn wound in an eye. And the end picture, which is, although scarred up, and there is some scarring in both the cornea and the lens there, actually that horse's vision is probably not that bad. Horse's vision is not that fantastic at the best of times, so they're probably coping reasonably well with that. But yeah, do take injuries to eyes incredibly seriously, even if they look very small. So everybody's got history of wounds on horses' legs that aren't doing terribly well, but actually they can do really well. And in my book, simplicity is the important thing to remember. The first 2 hours are critical because they can have such a huge effect on the outcome. A horse's wound will be contaminated with bacteria until the bacteria start to develop and live in that wound, and then it becomes infected. But while it's contaminated only, we can do quite a lot to get rid of it. Now, this is another principle that I really want everybody to remember. Please keep what you put on the wound simple, because so often chemicals and antiseptics are harmful to delicate tissues within the wound, and you will do a huge amount of damage with strong Hibby scrub, TCP, Dettol, all sorts of things that you might think would be suitable for a wound will actually do a huge amount of damage. In my book, and we'll come to it later, saline is the best thing to clean any wound with. So we're going to talk about a first aid kit. You may have to, a list will come up in a bit, but again, I'm going to go through the principles when it does. You can reread the list, talk to your vet, or actually, importantly, an equine veterinary nurse will be really helpful to you. There will be lots of people who have lots of ideas about what to have in a kit. Most critical thing is that you've got stuff to be able to clean a wound with safely without doing it any damage, and stuff to stop bleeding if bleeding's occurring, and then some stuff in sterile materials in the kit to be able to cover the wound while you're waiting for assistance. It's going to be reiterated again and again. Wound powders, purple sprays, all those sort of things, please don't use them. Wound powders just add foreign material to wounds, which the body then has to deal with in addition to the filth that was already in there. So please don't be contributing to the problem. I always say to people, I've had a number of cases of mud fever this winter that I've looked at, and you look at what people are doing to them, and I always say to people, look, if you could just do to your face what you're about to do to the horse every morning, then you'll probably start to understand why your horse's skin doesn't seem to be settling down. We can't be any more aggressive with a horse's skin than our own skin, and it's a really good maxim to think about. And rather grubby little bandage on the right hand side, clearly not in this country, but to remind me to say that actually horn and hooves are the same. Wounds through to the soft tissue, so where you've got blood in a horn or a hoof, is no different to a wound under our nail, and we really shouldn't be using aggressive materials or different techniques for wounds that go into those tissues. So basic principles, I mentioned this in the last webinar. Don't panic. If you are a panicker, please get somebody else to come and help. Always get someone else to help you so that you're not on your own, because obviously it's very easy for things to happen very quickly. Please remember PPE. I think we're all getting better about PPE, but it's so worthwhile putting a helmet on, putting some boots on that are going to protect your feet, and wearing gloves if you're leading horses around. And never ever put yourself into a dangerous situation. Injured horses are often very frightened, often hugely concerned. They won't mean to hurt anybody, but they can do you a huge amount of damage. Very important to put a head collar on and get the horse at least some control, because even if it's laid out flat on the floor when everybody finds it, they can quickly hop up, and I'm always surprised when I turn up to an incident to help with a wound or something, and the head collar's not been put on the horse. So yeah, let's get a head collar on fairly quickly so we've got some form of restraint. And if you're worried about being close to the horse, if you've got a lunge line, that's really helpful. You can put a lunge line on the head collar, and then you're some distance from it, but still have got control. It's very easy for horses, again, that are frightened and panicked about having been wounded, to hop up and then suddenly pose a huge danger by clattering out onto a road or something dangerous like that. Bleeding is one of the first things that we need to control in wounds, and it's a very simple, I'll go through some specifics about bleeding in a minute, but it's very simple. Use something clean. We're almost all of us wearing something reasonably clean these days. I think we know the people who aren't. And particularly in the winter, we've got several layers on, and it's quite often possible to strip off a couple of outer layers and then use a middle layer as a dressing if you've got nothing when you're out on a ride. Make a pad and apply pressure to the wound. Now, you'll see I put on this slide and I put on others, don't check. You really got to keep that pressure on the wound. If you keep checking to see whether it's stopped bleeding or not, it won't have stopped bleeding, I can tell you. And you'll restart it every time you lift the pressure away with the material and take the clots off the bleeding vessels. So apply pressure to the wound. If you've got really severe bleeding, which we'll come to in a minute, you can actually grab hold of tissue that is bleeding really nasty, and you'll get cramp in your hand, but you will potentially stop quite a lot of blood loss. Horses will sometimes be reluctant to move if they've got an injury, and unless they are in immediate danger, then it's probably best to leave them where they are, because a horse that's reluctant to move may have obviously our worst fear, which is a fracture. And if you can see any distortion to the legs or on anything, just don't move the horse. And as mentioned, don't offer it food. You can offer it water, but just in case an anaesthetic is later required for repair of the wound. If they'll move readily, then you've got time to get the horse to a safe place, which is clean and tidy, maybe well lit. And we always really appreciate it if the horse is happy to move, that you've got it somewhere before we turn up, rather than us having to do a 20-minute walk to the yard. So you're safe to see whether the horse will move. Horses that have a fracture and are perfectly conscious are pretty aware of the fact that it's not wise to move, and you will struggle to get them to move. So reiterating principles, as I said, I do throughout here, even very small wounds can hide really, really serious injuries. So we want to think very carefully about two things. Firstly, proximity to joints. All of you will know roughly where your horse's joints are, and about 5 to 10 centimeters either side of a lot of joints, there may be synovial structures. So if you've got small wounds over joints, then really serious, particularly if the horse is showing any lameness, because the lameness very quickly will develop and will show you that you've got a significant and very serious injury. And a horse that isn't weight bearing at all, despite having a tiny injury, has almost certainly got infection in a serious structure. The tetanus I'm going to mention as a principle, but just remember, tetanus vaccination is critical. There are so many little wounds that could create a tetanus infection. It costs relatively little, only needs doing every couple of years, and can stop you having to spend many thousands on trying to treat a horse that may die in the end. So definitely important. If there is a problem, it's not a huge urgency, but we can get tetanus antitoxin into them. But the tetanus cases I've seen too, have always been about 10 to 10 days after they've suffered a wound. So you don't know you've got away with it until sometime later. So here's the full list of a suggested first aid kit. There are lots of different things you can put in a first aid kit, but the most important things for me are some salt and a container that you can dilute some salt into, so you've got something to clean a wound with, some cotton wool to help you clean the wound. Then there's this stuff called Hydrogel. In this case, I put one of the trademarks on, which is called Intracyte. There are quite a few. There's Citrogel, there's New Gel. Hydrogels are really useful things. They're water-based, as the name suggests, so they dry up really quickly, but they've often got a bit of starch in them, which makes them into the gel. And they will actually help take bacteria and material out of the wound, and they'll most importantly keep the wound moist. So when you've cleaned it to the best of your ability, you can fill it full of hydrogel, which is going to preserve the healthy tissues for us if we end up stitching it up or whatever. And then there's loads of dressings mentioned here. To be honest with you, if you had a roll of Gamgee and a vet wrap, you'd be able to cope with most things, because the modern Gamgee now, the one with the paper lining, has it could be used as a dressing in itself. So really helpful. There are a few other things here. Most people have got a mobile phone now with the torch, so the torch is handy. But if you've got a head torch, that's even better to throw in. Antiseptic wash is on this list, but as I've said, I'd be much happier with salt. There'll be one or two things I'll show you when we get to lavage that you can throw in. And things like the equi boot, the gaffer tape, obviously really helpful if you've got a wound on a foot. As far as the equi boot and things like that's concerned, where it's so suitable for your horse, I found that your horse has to be the right shape of the factory-made boot. There's no one tailoring boots for horses, and if it's not the right shape, it's going to rub, it's going to fall off. So you may need to sort of buy several boots or share buying several boots with other people. Twitch, we can talk about twitches later if you wish. Twitches are very handy for short-term, relatively quick restraint of a horse, and they work incredibly effectively in most horses. I always find that horses that people tell me won't be twitched will very safely be twitched when they haven't got the owner that says they won't be twitched with them. So I'm really, although I know some people don't like twitches, they can make the process very quick for the horse. They can make it very safe for those people around it, and they really can be used if they're used carefully, very safely, I believe. So back to the first principles again, restrain the horse, get it comfortable, make an assessment of its immediate needs. Bleeding, as we said, we control. I'm going to come back to that in a bit more detail in a minute, and get it to a safe place. So the bleeding, just important to understand the types of bleeding we're talking about here, because a lot of people will look at the bottom one here, the capillary oozing blood from a wound, which will produce, you know, quite a lot of redness, give you quite an impressive view to look at, and get quite concerned about it. And I can say to you that you don't have to worry about that at all. The top one, the arterial bright red blood that is squirting out at some speed and creating a huge pool on the floor, that's the one to be a bit more concerned about. And as I said to you, you can put a lot of pressure on with a pad, or you can even put your hand in there and just grab hold of vessels and stop them bleeding. The middle one, the dark red blood, it would be coming out fairly quickly, but sort of oozing. You don't really need to know, other than the quicker the pool's appearing, possibly the more urgency. And most importantly, please don't check that you've stopped the bleeding. If you're stopping the bleeding, well, do not take the bandage off. If anything, if you've got lots of breakthrough, stick more bandages on and more pressure from the outside. So you'll get some huge wounds like this, but this wound almost certainly will have created quite a lot of capillary ooze, quite a lot of blood around, but actually probably didn't cut any major vessels at all. And as we said earlier, with trunk wounds, probably healed incredibly well. You can see how it was dealt with on the right. As far as cleaning wounds is concerned, tap water is okay, and tap water with a bit of salt in is better than tap water on its own because of the effect it has, the osmotic effect it has on the tissues. But if you've got a grossly contaminated wound, lots of dirt and muck in it, running a tap slowly, tap water out of the hose onto the wound is certainly not the wrong thing to do to start off with. But in time, using water with some salt, a teaspoon of salt to a pint of water, so two teaspoons to a litre if you like, and using it in some form of lavage way. So you can either use it from a bucket directly with cotton wool, or you can use a squirty device. We'll show you one or two. Those little hose lock devices that you can get for the gardens actually work really, really well. I'll show you a picture of that later. So I'm going to rattle through certain types of wound just very quickly. As I said, no apologies for repetition, but we'll get on, and then you'll be able to ask me some questions. So this is more sort of instructions for what we're going to do later. But these two wounds here, you can see really nasty looking wound in the mouth where various teeth have been knocked out. But actually it's the wound on the left which is possibly more severe, because that wound there almost certainly gone into, well, it had gone into the joint. That's why the horse has been anesthetized and necessitated the joint being flushed. So although you'd be concerned as your horse went down on the road that it had broken teeth, actually it'll probably cope very well and we'll deal with the broken teeth in no trouble. The one that's threatening its career is the one to the front of its knee. So as I've said, pack with Hydrogel. If you're going to take hair from around any wound you're dealing with, do it very carefully, because you don't want to put hair into the wound, and that's one of the reasons you put the Hydrogel in first. We're going to have a little talk about exposed bone. This picture here shows very nicely a bit of exposed bone, really delicate stuff bone actually, and a living tissue. It's often tempting to imagine a dry skeleton when you think of bones, but bone bleeds. It's often very pinky coloured when you see live bone, and needs caring for. So first thing to do once you've stopped the bleeding is lavage. We're trying to get rid of all the dirt we can. We're trying to get rid of some bacteria to reduce infection. It's going to get rid of some of the dead tissue, And each time we do a dressing change subsequently, then we're going to get rid of material that the body doesn't want. And we'll be able to keep doing that until the body has decided it's happy with what it's got. As it says there, warm water is better than cold. Water's okay, saline's much better. Don't use antiseptics. Everybody wants to use Hibi Scrub because they somehow feel it's going to be better than salt because it kills bacteria. It kills bacteria, it kills tissue too. So please don't use anything else. That hose lock pot on the right hand side, I think they're really good. You've got one there that you can fill up with salty water, and you can actually then spray from a distance at a pressure which isn't going to be concerning for the wound, and excellent to take to competitions and things. So really handy way of cleaning up a wound. I'm going to rattle through this. This is more sort of veterinary, but it's whether wounds should be closed. But the reason I put this slide on is to discuss that actually not all wounds need closing. They will heal very nicely by what's called secondary intention, where they'll come together. And sometimes we can close wounds later, so having got them clean. If you stitch a wound too early, before it's when it's got contaminated, all you're going to do is create a pocket underneath the skin, which is going to turn into an abscess, and it's going to break open anyway, so not worth it. But do not assume, because you can see a big gap, that it isn't something we can stitch. Often the skin's very elastic, it will have opened up, it will have created quite a hole, but actually there's quite a lot of skin to be brought together. So you can see here, the skin's sort of gaped, it looks like there's bits of skin hanging over, and people often wrongly assume that the skin's missing, but actually you can bring it back together if there's plenty of movement. And higher up the leg, as we've got here, there's plenty of skin to bring together. It's lower down the leg where we have more of a problem with these things. So I've mentioned all of these, but this is just to follow on what we would do. We're going to be assessing whether we need some antibiotics. Don't always need antibiotics, particularly in the early stages. We may well be really happy that the wound's clean. Very much repeating myself here, but teaspoon of salt in a pint of water and no chemicals. So there are wounds in special places. Wounds on heads, everybody's worried about these. I've seen a couple of wounds like this. They're often caused on horse walkers, funnily enough, when horses panic, and they look really dramatic, but they heal incredibly well. Horses' heads, wounds on heads do heal really, really well. There are some that don't. Worth looking into how you do some bandaging. Do get some demonstration from your vet on what to do, because these days, although there are some really intricate figure of 8 bandages for knees and hocks shown in books, if the bandage slips, they actually just move and the pressure points get pressure put on them. If you put a vet wrap on, just as if the leg was a tube, you can use a scalpel blade just to cut holes over the pressure points, and that works just as well. So we talked about hydrogels, and it's really this slide to remind me to talk about dressings. Just as creams and potions and everybody swears about honey and all sorts can do damage to wounds, so can dressings. And there are some adherent dressings which, as the wound dries a bit, they adhere to the wound, and then when you pull it off, they can take some good tissue with it. Now they're really good if you're trying to get rid of lots of necrotic, horrid material. So your vet may well guide you to use adherent dressings in the early stages. But the dressings that are right for an early stage may not be right going on. So some of the best ones, I'm afraid, are the most expensive. We use one called the leave-in, which is this hydrocellular foam. They're non-adherent and really kind to the tissues underneath them. We like using a thing called Softban, which is a bit like a flattened out cotton wool. The reason we like Softban is it wicks fluids away from wounds quite satisfactorily. Unlike cotton wool, which can get soaked and be bathing the wound in nasty contaminated fluid. and then you want something over the top, so a vet wrap or something over the top. Quick mention again of Intracyte's the one I mentioned before, Hydrogel there, and then there's this honey dressing. Just a word on honey, because people do get keen on honey. They feel that it's sort of the fix-all. Honey actually is really good at helping you debride wounds. The reason it's going to inhibit some of the bacteria is because it's so strong in terms of its sugar content. It's a really, really highly concentrated sugar, and it will help differentiate between live tissue and dead tissue. So if you're trying to debride a wound and get rid of sort of gunky material, honey can be really useful. But it then it can be too aggressive when you're trying to, you've got the wound clean and you're trying to get to the finer points of healing. So it has its place, really useful early on, but don't use it throughout. Dressing changes, now I always say to people that they need to be done as often as they need to be done. Really unhelpful, but what it really means is that each individual wound will need different times of dressing changes. The more gunk you've got coming off the wound, the more frequently you need to change them. Don't use these things. Please, please, please don't use these things. If you take anything away from this, it's don't use some of the rubbish that I suspect you'll find on all of your yards, and particularly go and have a look at your first aid kit, because if you open some of the pots, you'll find there's quite a lot of rubbish inside. So these are the wounds that will really, really come back to bite you in more ways than one. Small wounds over joints, please remember that they can be critical. And the wounds, overreach wounds or wire wounds to the back of the pastern, which you actually probably can see little strands of tendon here, they can go incredibly deep. And because of when you lift them up, particularly in the hind limb, they crunch closed. You can't see how deep they are. Whereas these wounds, big trunk wounds, you can see from this lovely series of photos, will do incredibly well and really are of no concern at all to us in terms of thinking about them long term. Yeah, much prefer dealing with these than the tiny wounds. So this is some of the stuff I want you to take away. Do try and keep yourself safe. Remember how the wound happened really matters to us. Then it's where the wound is that's going to be important to us. And how long it's been there. You can see this bottom right wound, which has actually got some proud flesh on, so it's almost certainly been there for a while. But a wound like that, any wound that's that badly contaminated and looks like it's been around for a while is going to need different management to a very fresh wound like the one on the left. Very quick word on proud flesh, because I thought it would come up. Now, the most important thing to remember about proud flesh is that it's caused by effectively infection, irritation, and when I say irritation, rubbing bandages, rubbing boots, rubbing stuff over the top, and movement. And so treatment is dealing with those factors. If you can get rid of those factors, you're not going to get much proud flesh. Again, people like to use something that's going to sort of burn away the proud flesh. They've got all sorts of things that they've thought about. I tend to find that if you can get on top of what's causing it, then actually trimming it back and dressing it will really help. Some infected wounds, and this really nastily contaminated one's going to be one of those, benefit from allowing the proud flesh to get really quite thick, and then when you trim it back, you're taking most of the rubbish away with it, and they'll do really nicely. So proud flesh is more about avoiding the problem in the first place. Lots of people don't like box resting their horses, and I understand why, but actually if the horse is still moving around, even with a wound that's away from joints, it'll be moving that wound, and the proud flesh will form. We don't quite know why horses get proud flesh and ponies don't seem to, but hopefully someone will find out one day. And there was an incredibly good inhibitor of proud flesh on the market a few years ago, but very sadly the market's too small to have maintained it. So it was called Volcatan. Some of you may have had experience of it, and it was very, very effective, but sadly not available anymore. So prevention better than cure. Do go around your stables and pastures. Just check out for sharp bits that might create the problem. Barbed wire is a concern, I'm afraid. I know it's used all over the place, but it is a concern. And do check your insurance, because some insurers will not insure you against wounds if your horse is in a field with barbed wire. And do check regularly for risk factors. Very important if you've seen blood around to find out where it's appeared from, and make sure your first aid kit is clean and complete. Don't let people, it's very, I'm afraid, I find a lot of the first aid kits have been raided by people who want to just deal with a routine wound, and then when you've got a nasty bleeder on the yard, you've got nothing sterile to put on it, and that's very frustrating. Thank you very much indeed for your attention. I'm sure there are some questions.
Chris, thank you very much. You're sure right. There are some questions. So that is brilliant. Clearly, you're not on a retainer from the maker of any wound powders or purple spray, which is good to know. And just some of the words I wrote down: safe and simple, and you know, being careful. I love not being careful not to interfere with what nature is naturally trying to do. And so, actually, sometimes doing nothing is the right thing. So I thought, indeed, and I love the way you periodically came back and reminded us of the key points to take away. I also love the fact that in your younger years, Chris, you Scottish dance in front of the Queen Mother.
I did.
Blimey, do you still Scottish dance today?
I do, yeah. If we given half a chance, yes, I love it.
Good lad. Maybe next month's webinar. Good. Now listen, Chris, we have got a lot of questions. So just remember, if you're on Facebook, then put them in the comments. If you're on Zoom, there's lots and lots of questions there. Please do upvote them if you can, or put on. Chris, what I'll say, I mean, some of these questions you've covered to a degree. Some of them you can answer yes or no. So we'll see how many we can get through. But Chloe's kicked us off. How do you know if pus is infectious or helping to heal the wound?
The answer is you probably don't, other than pain. Infected wounds are very, very painful, and I usually say to people, if the horse is reacting when you're pressing near or around the wound in the same way as you'd react if someone was pressing sunburn on you, there's almost certainly infection involved. Where if it's not that painful, it seems to be relatively comfortable around the wound, that the material that's coming off is probably just the horse discharging foreign material, damaged tissue, that sort of thing.
Brilliant. And obviously with sunburn, better to avoid it in the first place than get it. There's two people have asked, Kerry and on Facebook, thoughts of using a medical grade Manuka honey. You obviously touched on honey, yeah. But what about using Manuka honey, either after cleaning with salt water or just more generally?
So yeah, I mean, I should have said what I was really talking about. Most people are using honey, which is in fact Manuka honey. So yeah, medical grade Manuka honey. My comments about honey exactly the same. It's about Manuka honey. It doesn't matter that it's Manuka honey. It's still honey. It's going to be really good in a contaminated, infected wound, and it's going to really help get you to the right position in terms of having a clean wound, one that is going to heal well. But after you've got it clean, it's really critical not to carry on using it, because it will damage the tissues after that. So yeah, it's great stuff. There was a test done a few years ago into whether Manuka honey was actually any better than any other honeys, and by a friend of mine from Glasgow Vet School, and he decided to plate up, so in other words, put on a bacterial plate all the honeys from lots of shops, just to check that they were bacterially sound before.
And don't tell me Aldi won.
No, unfortunately, there were one or two major suppliers of honey where he isolated rather unpleasant bugs that he found in the human gut from the honey. So, so not always a good idea to use standard honey. The only condition, and this is a by the by, that actually standard honey from any shop is quite effective for is thrush in the horse's frog. Really good to use on thrush, but I wouldn't be using them on wounds.
Okay, there you go. That's a bonus. Excellent. Thank you very much. Hannah's asked, can you use Milton? I've seen Milton sterilizing fluids on wounds.
I definitely wouldn't, no. Milton is a good way of sterilizing equipment, and it's really effective at that, but it's actually too aggressive for the use on wounds. No.
Brilliant. Chloe's asked, if the wound was in the eye, how can I look after it while I wait for the vet?
Yeah, really good question, Chloe. You can create you can either leave it well alone, because actually there's certain processes within the eye that happen very quickly. Many of you will have seen dramatic swelling around the eye, and that's nature's way of protecting the eye. Or you can create a donut bandage. So effectively, roll up a bit of Gamgee, turn it in a circle, and put that around the eye, and then put a bandage over the horse's head. But anything to avoid pushing anything that might be in the eye into the eye further.
Brilliant, thank you. Someone on Facebook has asked about the weather. Does it make a difference for wound healing? Such as will wounds heal better in the summer than the winter?
Yeah, actually, it does make a huge difference. I think it possibly is the other way around, actually, because my experience is that bacteria are more active, grow quicker in the summer than the winter. And anybody who's been to the tropics will know how quickly wounds in the tropics get infected. And so, yeah, I do think it makes a difference. That said, it's very important. I've mentioned this at the last webinar. There's this tendency to want to dry wounds. We want to keep the tissues moist. They heal far better in a moist environment, but they also want to be kept warm. So they want to be kept at body temperature rather than desperately cold. You may find that actually, if they're really, really cold, they would slow down. So I think too much heat, you're going to get more infection. Too cold, you're going to get it slowing down. So there's probably a Goldilocks zone there somewhere.
I was going to ask, Joanna's asked, why broom handles in the vet kit?
Very much as splints. And now we're not trying to splint a fracture here, but actually, if you've got a horse that has damaged a tendon, if you've got the broom handles, you're going to be able to help the vet in stabilizing the horse's leg in terms of making it easier to transport, easier for it to move. So yeah, no, that's definitely what they're in there for.
Brilliant. I had a couple of questions, Chris. The honey trial research that you referenced, is that being published?
No, I think after he'd isolated fecal coliforms from the honeys, I think he stopped the trial, decided he wasn't going to put it anywhere near human wounds.
Right, fine. Brilliant. Wendy's asked, should we throw away all wound powder, purple spray and Hibi scrub? Are they useful for anything? And if not, why are they sold? Right.
Wound powders have no idea why they're sold other than history, actually. When we had gangrene about and no antibiotics, I think actually getting wounds dry was probably better than nothing. In fact, much better than allowing gangrene to develop, but we're way beyond that now. So they're just historical wound powders, and definitely they should be thrown away. There was something in between wound powders and Hibi scrub, which I've forgotten.
Purple spray.
Purple spray, yeah, definitely. There's a problem with purple spray. So there's two types of well, there's purple spray and sort of bluey green spray. Bluey green spray is the one that's been prescribed by a vet. And please don't use it, because actually they've shown that the antibiotic that's in it doesn't get to a high enough concentration to be effective for very long. So actually all you're really doing is exposing bacteria to the opportunity to get resistant. So not great thing to use. And the purple sprays, gentian violet used to be actually quite a good antiseptic, but many of them being replaced by crystal violet because it washes off your hands easier. And I think gentian violet was carcinogenic. And crystal violet's not that effective. So I wouldn't be using a purple spray at all either. Hibi scrub, now Hibi scrub can be useful, particularly on unbroken skin when you're trying to deal with things like mud fever, for instance. So I certainly wouldn't throw Hibi scrub away. And if you really were being disciplined and only putting 10 mils of Hibi scrub in 5 litres of water, you probably wouldn't be doing any harm to a wound. But seeing as it's most people don't measure out their Hibi scrub and they probably make it too strong, it's much easier to use salt. You're much less likely to do any damage. So I don't think it's a huge lot better than salt. But it's a good product. We use it obviously to try and sterilize our hands before doing work. So yeah.
Brilliant. Chloe's asked, what if the horse has had a wound in the field? Would I leave the horse there until the vet arrives, or should I move the horse to a safe place?
So Chloe, I think that's very much whether the horse is mobile. If you can see a reason why it isn't mobile, so you've got a distorted limb, for instance, or you've got tendons hanging out, then probably leave it where it is. If the horse will move freely and it's not very lame, then happily move it, because it's going to be dealt with much more effectively and much quicker if you've got it into the yard. So I think I'd be guided a bit by the horse, how it is and whether it's happy to move. And if it's not at all happy to move, don't move it. And your judgment. And if you can see some obvious reason why it shouldn't be moved, please leave it there.
I think I know the answer to this one, but a question from Facebook: can you use iodine on a dressing for a wound?
So yeah, I wouldn't. Again, iodine, or actually iodine substances, again, can be very good antiseptics, but incredibly dilute. I mean, to the point we always say sort of weak urine rather than strong tea, and we do use them periodically. But I wouldn't be using them. I would use, it's so easy to think you're doing the right thing because you've got a product that's going to kill bacteria. And yes, it will kill bacteria, but it'll also kill delicate little skin cells that are potentially going to help you heal that wound. So you want to be washing away the bacteria and the tissue and materials that aren't required with something that is biologically safe. And that's why I keep coming back to saline. You can do very little harm with saline at the right dilution, in fact almost none. So yeah, I would stick to that and not think you can do any better.
Chantal has asked just for a recap on what to have in the first aid kit, and we can probably do that separately. But a question on Facebook: should the first aid kit be per individual horse?
Yeah, that's a really good question. Probably not necessary to have per individual horse, but if you haven't got, you know, probably per individual lorry is a good way of putting it, unless you're talking about those polo transporters with 10 horses up. But if you've got a decent first aid kit, probably best to assume that you want to be able to, at the minimum, deal with 2 nasty bleeding wounds, and then you're probably safe. If you're going to a competition, you're going to find other people with more than happy to scoop out their first aid kits and help if there was a huge disaster.
Brilliant, thanks, Chris. Barb has asked. Barb is very busy. I wash my wounds with aloe juice, colloidal silver and lavender essential oil, and cover with Himalayan salt, French green clay, and rosemary leaf. Your thoughts?
And then put into the oven at gas melt 4 for 2
Well,
hours.
I was about to say, it sounds like Sunday lunch, doesn't it? But yeah,
it does sound really good. So I'd need to recap on some of the things. But Barbie, you've picked up on some really interesting stuff there. As I've mentioned, salt, and whether it needs to be Himalayan or not, I'm not sure. Interestingly, rosemary infusions are actually mentioned in a lot of the herbal books, and I think that rosemary probably is slightly repellent to insects. I'm not convinced it's got any healing properties as such. Aloe vera is an interesting one to mention, because that's just a different type of gel, if you like. So a lot of the starch-based gels are effective. Aloe vera is a really good product. I've used it many times. I've actually used the natural product in the tropics, because it's often the only place you'll find a clear and clean gel. And there's one in particular aloe plant that has tiny little pods that you can use and actually happily drop into your eye. I'm not sure whether it's recommended or not, but it's fine. So some of the things you've got there are probably helpful, but just do be very, very careful. You don't want to be you're probably with the best will in the world, you're trying to do the best thing for your animal, but all these little things you're adding in, the body's got to cope with and deal with. And often, if they're really good at killing bacteria, as I've said, they'll be good at killing cells too.
Brilliant. Someone on Facebook has asked, are leeches or maggots still used to clean wounds?
Well, yes is the answer. They are, and they're not used very frequently in veterinary medicine because we don't have very good access to them. We could get them, but then they can be quite expensive. Maggots are incredibly effective at helping sort out, in particular in wounds where you've got a lot of damaged tissue. So in humans, if you can imagine a car accident, and there are similar wounds sometimes in horses where a lot of tissue damage is created. So you've got dead bits of muscle, dead bits of tendon in the wound that are difficult to get out. You might have operated to try and cut them out, but maggots will sort them for you, if you like, and they'll melt away the necrotic material with their digestive juices. So really effective. Leeches are used for a completely different process, actually. What they're used for is to create vascularization in tissues that have been repaired and have got poor vascularization, because they've got the leech has an anticoagulant in its saliva so that it can keep ingesting blood, and if it's put on to tissue that has poor blood supply, it can help with that. The difficulty they have actually is persuading the leeches to attach, because any self-respecting leech wants to be attached to healthy tissue that's going to give it a good blood meal, not unhealthy tissue that's going to give it a poor one. So, but yes, they are both used and effectively too.
Brilliant. Carly, I'm not sure whether she's referring to leeches or maggots, but it's mentioned that they've recently been prohibited for use in the continent. I wasn't aware of that. Chris, Rachel has asked about wound creams. And actually, I think someone's just come out, in the summer to keep the flies off. Should you use them? She says, I use one on my horse after cleaning a small wound to keep it clean, and it seems to help close it up. But should I just bandage it instead?
No, I'm actually in favour of some of these creams. Now, the important thing to remember is there's probably only 3 different types of product, and there are 2 of them that I think are really useful. There's the gels I've already mentioned. There's lots of different ways of using gel, and the most important thing is that they're used, they're clean and sterile when they're used. And then there's aqueous type creams, and most of us are familiar with the sort of E45 type creams. Maybe your vet has given you Flamazine in the past. These are water-based, but they've got a little bit of grease in them, so they're just slightly more persistent. They don't dry as quickly as gels, and they are really effective. And Flamazine, for instance, has an antibiotic in it, which probably doesn't help that much, but it's also got silver in it, and colloidal silver actually was one of the other things that was mentioned. Very effective at inhibiting bacterial growth. And so I quite like those aqueous creams for keeping wounds moist. As I've said, we want to keep them moist, and if you're not dressing the wound because it's a very small wound, that gel will keep it. That aqueous cream will keep it moist for longer, and physically potentially stop the insects, the flies going into the wound. Then there are the greasy ointments, and I would steer well clear of that. I'm not a particular fan of Sudocrem. It's sort of too greasy and too sticky, and to my mind seems to attract more dust and dirt than be helpful. As far as fly repellents are concerned, there are creams like that wonderful yellow cream that makes you look like you're a 1970s smoker. I think they're very effective, but I tend to suggest applying them like a smile, so around the sides and underneath the wound, so there's no risk of them leaking into the wound, but they will provide you with on the edges around the sides of the wound, they'll provide you with something which is hopefully deterring deterring flies.
Brilliant. EC's asked, I've noticed we've got viewers from across Europe and across the UK, and someone's in Malaga. So other than moving to Malaga, how do you keep a bandage dry in rainy, wet weather?
Bring the horse in.
Yeah.
Having a bandaged leg out in the field, really, if you're getting a bandage that's soaking, they tend to tighten, they move, they can cause pressure sores. There was a picture actually that I didn't mention, but you can easily do harm if you put bandages on too tight. There was a nasty one with necrotic tendon tissue. I should have mentioned that. So yeah, just make sure the horse is under cover. That's the only way to keep them dry.
Chris, at World Horse Welfare, we care for about 350 horses at any one time. The farm teams will check the horses who are mostly out at grass twice a day, and so they do that first thing in the morning. And obviously, the teams are well sort of versed in knowing what to look for and when to call for help. Do you think livery yards, with over 50% of horses in the UK in livery yards and estimated, should they have a written plan in place should a wound be seen on someone else's horse?
Yeah, I think it's really critical to have, I mean, you see them, a lot of the stable cards, but they should be, for each livery yard, the livery owner should have a plan that allows them, if they can't get hold of the owner or they can't get hold of the owner's vet, to use the vet that they use, whatever, to get something in, because the horse doesn't know the intricacies of the human arrangements, and it needs dealing with as soon as it possibly can. So yes, I think having thought about it beforehand and have some understanding about who's going to step in and do something if you're not available and not there to deal with it yourself, it is well worth doing, because the most important thing for all of us is to ensure that the horse is dealt with in a timely manner, which is going to be beneficial for the horse and ultimately beneficial for you as its owner. So yeah, I agree.
Brilliant. Inkst has asked, her mare was badly kicked as a foal. She has a scar on the inside of her near leg. She has a horn growing from the scar, and has been for the last 15 years. And when the feet is done, they use the nippers, but it still slowly grows back. Why is that?
It's probably, without being able to see it, it's probably a thing called a keloid scar, where the scar material produces a sort of keratinized material. It's actually a sort of a prolonged granulation tissue, if you like, and it produces this tissue is quite like the chestnuts. And once it's got to a certain distance from the body, it's obviously not living anymore. It's just dead, hard, horny material. So that's probably what it is. If it's not bothering the horse, I wouldn't worry too much about it. They're unpleasant, but my heroic efforts in the past of trying to deal with scars like that have cost the owners quite a lot of money. They've taken several months to deal with. And very often we've ended up back at square one. So if it's causing significant problems, by all means try and do some cosmetic surgery. But actually I've found that cosmetic surgery can frequently be unrewarding.
Brilliant. Keep it simple. Jean has asked, her horse has had a foot abscess. It's well on the mend, but the farrier has said should keep the foot clean to prevent further infection. Any questions? Any suggestions?
Yeah, definitely. I mean, horses with foot abscesses, they're going to leak out for sort of 2-3 days max, but they need protecting to keep them clean for at least a week afterwards. In this sort of weather and this sort of time of year, probably 10 days before the tissues underneath have hardened up enough to be exposed to mud and muck. And very often where the abscess was draining from, it would be better if the farrier or vet has smoothed out the area and sort of made it so it's not going to trap material, because if it is going to trap material that's going to be pushed and pumped up into the foot again, you're soon going to reach the soft tissues. So yeah, protecting them is really important.
Brilliant. Kate has asked, what would you recommend to use in a high wither wound other than cleaning it?
Yeah, they can be really nasty. So there used to be there's a little bursa, one of those little bags of fluid that I was talking about, on the top of the withers, and so the withers are very vulnerable, and in days gone by they used to get a thing called fistulous withers very commonly, where that bursa would get infected and leak out, and it's really difficult to dress them. I've seen it only once or twice. Really difficult to dress them because of where it is. And it's similar to the eye in some respects, is that the only way that, if you can cover it, the only way to do it really is to get a rug and stitch in rolls of material, and it can be quite elaborate, so that you're lifting everything off the wither, because any pressure you put on the wither, one, the horse usually finds incredibly painful, because it does seem to be very, very painful there when there's say a pressure sore, and two, you're just going to squeeze the blood out of the tissues and create more of a problem. So it's very, very easy to actually make the problem worse. So either leave it undressed if that's a possibility, or if it needs protection in some way, then you're just going to have to be really elaborate with cushions or something either side to create a sort of tent effect over the top, so you've got no pressure on it.
Brilliant, thanks, Chris. Chloe, and there's a question from Sue as well, quite similar. If it's a small wound and you're not sure if it's in the vicinity of the joint, even if it looks like a superficial skin rub, would you still call the vet?
So yeah, I think I definitely would call the vet. I hate it when somebody says, "Oh, I didn't want to bother you." I'm here to be bothered. That's what I do. It's my job, and I don't want people to wait and hesitate. And it's far better to have made the decision on whether to leave it with the vet, who is then going to help pick up the pieces later, than it is to have made the decision and then find out that you were wrong. So there will be a number of things that with each individual wound that they may well ask you to do to help clarify whether we've got a puncture that's gone through the skin into the joint, or whether it is indeed just a simple graze. And as I said to you, any wound anywhere near a joint that's resulting in lameness, I think deserves to be fully assessed, because it's so easy to get past that 24-hour period when it would have been easy, or relatively easy, to deal with it and end up with a totally sound horse, and end up with a horse that's chronically lame.
Brilliant. Facebook question, what are your thoughts on hydrogen peroxide?
Oh God, it looks really impressive because you get a lovely fizzy, buzzy thing. But again, it does damage tissues, I'm afraid. And then all it leaves is water and oxygen in the air. So it's not something I use a lot of. It really stings. Human medics use it quite a lot, and I've been bitten on the hand, and I've dug various implements into my hands, and they always like to use it to clean wounds. I think because the effervescence can help shift materials out of the wounds, but goodness hell, does it sting. So I don't tend to use it in horses. I think it probably isn't as helpful as we'd like it to be.
Brilliant. Freya's asked, how can you tell if an old injury or kick to the hock and lower down the leg has affected your horse later on in life? Sometimes it can be very hard to see if the horse has very thick feathers.
Residual lameness, probably. I mean, I think it would be all very dependent on the wound. We obviously see a lot of these scars on horses' legs when we're vetting them. If I see a horse with a scar on its leg and it's over something that I think might have got damaged, and the horse is lame, I might well assume that it's the scar, but I can't really prove that. But if I see a scar and it's moving freely over the tissues underneath and the horse is perfectly sound, I usually describe them as cold, inactive and non-painful and of no concern. So I think it's very difficult, and it's probably on a case-by-case basis.
Brilliant. Well, listen, we've got about 5 minutes left, Chris, so we're going to enter quick fire round. So if you can keep your... so question from Leah, how many different types of wounds can you get?
Oh, crikey. Probably about 5 or 6 if I wanted to categorize them.
Fine. Okay. I like this question from Facebook. What if I don't spot a wound straight away and it's a couple of days old by the time I notice it? Will I be judged by the vet?
No.
There you go.
Not this one.
No, absolutely. I know. And I mean, as soon as, isn't it? I mean, absolutely. Obviously, in the COVID world, Karen has asked, hand wash in first aid kit is for human to ensure their hands are clean when tending to the wound. Is that a good idea?
Yes.
Brilliant. Julia has asked, what dilution would you recommend for making your own saline?
A teaspoon of salt in a pint of water.
There you go. And she's asked, can it be too salty?
Yeah, it can. Yes, the concentration of the salt could do damage to the tissues. So yes, if it's too salty, it's not helpful.
Brilliant. There's been quite a few questions about silver sprays, Chris. Obviously, we've talked about other sprays. Any thoughts on silver sprays?
Yeah, I mean, I quite like silver. It can be quite effective as a bacteria sort of static material. So it's not creating a risk of resistance as such, and it's less damaging to tissues. So yeah, they can be effective if you really want them. Yeah.
Brilliant. Is aloe spray on your not to use list?
Probably not on my not to use completely. I'd have to ask the question though, why you're using a spray rather than using, say, some form of aqueous cream, which I would say would be more effective in terms of keeping the tissue moist and making it heal better. It's probably just ease of use, but I don't think it's any more effective.
Brilliant. Chloe's our top question asker tonight, and she's asked some brilliant questions. Are the different bleeding types different colours?
Yes, they are. Bright arterial blood coming out very quickly tends to be quite bright cherry red. Venous blood will be a darker, sort of almost more purpley colour.
Brilliant. Would scar tissue, just from Facebook, from a previous wound on the pastern be a cause for concern if there is no additional swelling after exercise?
No.
The top picture on the slide of proud wounds, the top picture on the slide, you know, your proud wound slide. How did that happen?
How did the wound happen?
Yeah. Oh, yeah. So how did it get to being like that? Do you know?
Oh, I see. I think a combination, almost certainly, of infection and sort of inappropriate management in terms of not being bandaged and the bandage not changed often enough, and it being the bandage moving over the top of the tissues.
Brilliant. Nia's asked, is there any type of sedative available to help calm horses in a wound treating situation if a vet isn't required?
So no is the answer to that, Nia, because the horse would have to be seen first by the vet for you to be able to have the sedative. So you can't really have the sedative in your kit. There are some oral sedatives which can be helpful in terms of managing horses for bandage changes and keeping them quiet so they don't move around enough. You do need to be very cautious about them. They aren't as effective as injected sedatives, and sometimes aren't as safe in that they may give you reassurance because they make the horse look quite sleepy, but actually the horse could rapidly wake up and kick you before going back to looking sleepy again. So they're helpful, but need using under guidance and certainly not suitable for a first aid kit.
Brilliant. Thank you, Chris. Alison's asked, can you tell me why vets scrub off what seems to be a healing scab?
Yeah, definitely. It's very, very tempting to believe that all scabs must stay put. The fact is that some of those materials, particularly if they're coming away, and I used what I called at the last webinar, the dog lick technique of just persistently wiping. If the material's coming away, it needs to come off because it's probably stopping the cells from healing, and it's probably holding in infection, potentially some dirty material. Now, when it's really adherent, then it's probably safe to leave it. But actually, almost always in horses, because of the way the wounds are and the way they've been created, you'll find that the material that you think is a sort of healthy scab is like just a dirty bandage over the top of the wound. And so getting it fully clean is going to make it heal quicker.
Brilliant. Nancy's asked about flies. I think we've touched on flies. A question from Facebook: what about animidazole spray for general first aid on horses?
Sorry, I'm not familiar with it.
And animidazole, animidazole. Animidazole. No, we don't know. Not sure about.
Right.
Anna's asked about Intracyte Gel.
Yes.
How do you use it properly?
Anyway, to be honest, because it's great stuff and you're not going to do any harm with it. But it is a bit more expensive. Properly, once you've used a tube, throw it away. Don't save stuff in your kit if you've opened it, because it's got no preservatives in it, so it's very safe. And liberally is the answer to use it properly. So clean the wound, get it as clean as you can. Loads of squirt of Intracyte on the dressing and squirt it into the wound. It's really safe in the wound. Really helpful product.
Brilliant. Last question from Sue: do you have a view on using Lucilin?
Lucilin.
Lucilin. Lucillin. Lucilin. Have I pronounced that correctly?
Yeah. Sorry. Again, it's not one I'm familiar with.
Fine. Okay. Well, we're not going to finish on that. Question on Facebook: I only have rainwater. If I put iodine spray in the water or add salt, is that good?
So definitely, you can add salt to it. Collecting rainwater, as long as you're what you want to do is make sure the material, the containers you're collecting it in are really, really clean, because they're the ones who are going to contaminate your rainwater. I mean, the rainwater itself is probably okay. There is a dilution of iodine, which left for a few minutes in water is going to render it more sterile than it was before. Depends on the strength of the iodine, but you probably want to check that one out on the internet against the strength of your iodine. But if it was making the water fit to drink, it's probably making the water fit to clean a wound with.
Brilliant, Chris. Listen, I don't know whether your castration efforts in Mozambique were a world record, but you've set a new target. Over 40 questions you've answered tonight. So thank you so much to everyone. I'm afraid there's a 13 there that we haven't answered, but I hope in what Chris has given us tonight has given you so much to think about. Lots of wonderful messages coming in. Thank you very much for joining us. Chris, you've clearly, you've talked about so much. You've given us some wonderful summary slides. You've given some wonderful answers. Having said all that, what's your take-home message?
So the take-home message is do no harm. It's so easy to do harm. Do no harm. So keep it simple, as Rowley said. Stick to salt water if you're in any doubt. Get the wound as clean as you can, as early as you can. And that's going to really help. The cleaning, you cannot be overly meticulous with the cleaning. So really careful cleaning. Don't put foreign nasty products into the wound, and you'll be on to a great start. Brilliant.
Chris, listen, thank you. Firstly, let me just say thank you to everyone again for joining us. Our next webinar is on 23rd of February, how to manage and care for the older horse. They also get wounds. And that's on the 23rd of Feb. And that's with Professor Pat Harris and Nikki Jarvis. We've put a link there for you to sign up for that. And we really look forward to seeing you in a couple of weeks. In the meantime, Chris, listen, just 1,000 thank yous. That was absolutely superb. We covered so much, and you've really given us lots and lots to think about. So I hope you did a very good job last year. You've done as good, if not a better job this year. That means you probably get treated to coming back to another webinar this year. So avoid all contact from Alana and Basil is my recommendation. But thank you. That has been superb. Lots of lovely messages coming through. So Chris, thank you.
Great. No,
and thank you again for everyone for joining us, and look forward to seeing you in a fortnight. Take care.